Hello, everyone. Welcome to another review class. So our topic is Yuan-Source and Luo-Connecting. Let's welcome straight from Sampaloc, Manila, Ma'am Trix Guevara. Good afternoon, Ma'am Trix.
Good afternoon, Doc.
Okay, let's make this fast. Okay, you have to answer yin or yang channels. On the
Mhm.
blank channels only, the Yuan-Source points are the same as the shoestring points.
Yin,
Yin, okay, good. The point where it is said the original chi surfaces and lingers.
Yuan-Source,
Yes. When the five zang are deceased, what points will you select first?
Yuan-Source,
Okay. Use of the blank points in the treatment of disorders of the zang,
shoestring,
shu stream. Remember, they're identical sa yin. Fundamental importance in tonifying and regulating the respective zang.
Yuan-Source, and shoestring.
Very good. Each of the 12 primary channels has a blank channel which diverges from the primary channel at what point?
Luo-Connecting.
Yeah,
Luo,
low connecting point.
Luo. Mhm.
Okay. The Yuan-Source points mostly tonify yin organs or yang organs.
Yin,
Good. Tenderness at the Yuan-Source points indicates what?
uh, pathological changes associated in the meridian
Okay.
and the inter.
Disease, pwede na disease. Lung Yuan-Source point.
Lung 9,
Yes. Li Yuan-Source point.
Li4,
Yes. Stomach,
stomach 42,
spleen,
spleen 3,
heart,
heart 7,
SI,
Si4,
UB.
UB 64,
Wow. Kidney,
3, kidney 3,
PC,
PC 7,
SJ, Santiao.
Santiao 4,
They have the same, no? SI4, SJ4. Gallbladder,
40,
liver.
liver 3.
What are Yuan-Source points used for?
It's not used to tonify the yang, but can be used to expel pathogenic factors or
So,
release
false. Yuan-Source can be used to tonify the yin and yang organs. Only the yin. For the yang
Mhm.
organs, the role of the Yuan-Source would be to expel the pathogen. Next, Li4 is used to,
Expel wind heat,
okay, SJ4,
clears heat from the gallbladder,
wow. SI4 treats,
treat pain along the SI meridian,
it doesn't treat the SI, only the channel. Stomach 42 treats,
acute facial paralysis from wind cold.
yes. This is very common, no? Although you can use other points, but I want you to needle this first. Stomach 42. GB40,
Resolves liver chi stagnation.
UB64.
Resolves damp cold in the lower warmer.
Okay, damp, cold, lower, warmer. Which Yuan-Source point would you use if the patient has the following symptoms? Okay, sore throat, shortness of breath, perspiration, bronchitis, heat in the palms and soles, so very yin deficiency, breast pain, yawning, shoulder pain that follows the lung channel. I,
I lung 9.
of course. What about if the patient has the following symptoms? Lymph node inflammation in the neck, mumps, clears nasal discharge. Just read the rest.
Li4,
Okay. Sudden aphasia, nosebleed, facial numbness, Probably facial paralysis, no? Mm.
Stomach
Atrophy.
42.
Okay. Stomach 42. Abdominal pain or swelling, body weakness, pain along this. Okay. Jaundice, constipation, abdominal distension.
Spleen 3.
Yes. Aphasia, heart pain, rapid heartbeat, dry mouth, fullness and pressure, pain in the arm along the heart channel,
Heart 7.
looseness in the joints, long finger shaped warts or scabies. So
Mm.
these warts are located along the along that channel. Okay.
SI4.
Yes. What about nasal congestion, headache, eye pain, rectal prolapse, hemorrhoids, nosebleed?
Bladder 64.
Okay. This is really damp cold. Then the lower burner would also affect the, yeah, there's just too much phlegm, too much yin. Which Yuan-Source would you use if the patient is the following? Low back pain.
Kidney 3.
Okay. Chest pain, emotional issues.
Mm. Pericardium 7.
Great. Deafness, constipation, conjunctivitis,
Sanjiao 4.
weak and flaccid muscles of the foot, headache, eye pain, and large thyroid, swollen lymph nodes, the route of the, yeah, pain in
GB4.
GB40. Itching in the pubic region, testicular pain and swelling.
Liver 3.
What is associated with the Yan-Source points? What kind of chi?
Original.
Yeah, original or Yan-Source chi.
Yan.
Where does original chi come from?
The area between the kidneys.
Yeah, I mean, okay. What moves the
Hanging.
yuan qi throughout the body?
Sanjiao.
Yes. That's why you have to needle bladder 22, back shoe of the Sanxiao. Yan source points have overlap in function with which shoe transport point?
Uh, shoestring.
Yes.
Hmm.
For the yin channels, the yan source
Yung
shoe stream are the same. Okay. What similar indication is noted for shoe stream and yan source points on yin channels?
both treats disorders of the Zhang. Shoestream are the fundamental importance of tonifying and regulating the respective Zhang. And the yin channel's primary point is for this purpose.
Okay. Okay. Yan source points on the yang channels. The location.
Location. Yan source display points between the Shoestream and the Qing River. Usually the fourth point from the distal end of the channel.
Okay. The actions.
Action is different from the yen source. On the yin channels, it's
The yang to ha,
the
yang. Mm.
yin.
No, the question is the yang source points on the yang. Kasi we
I don't
already
have
functions of the yang source points on the yin channels. This time we go to the the action.
yang.
Yang,
Sure,
the
I think
yang
it's
yan source.
tonifying effect. Mm-mm.
Okay, this is more about eliminating the pathogenic factors. Diba? So
Mhm.
they do not have that much tonifying effect on the fu, on the young organs, diba? What are the general actions of the Luo-Connecting?
Treating disorders of their interior or exteriorly related channel, or the Zangfu.
Mhm.
Treating disorders in regions reached by the low connecting channels. in
Yeah.
treating psycho-emotional disorders.
Yeah. Because this is what happens, no? If you were not able to resolve your emotion, eventually the organ will be affected. In the same way that when you have an issue with an organ, you will also have an issue with your emotion. What is the therapeutic effect of using Yan-Source points?
Treating disease of the corresponding Zhang organs and assists in making diagnosis.
Okay, so practice palpating those points. Okay, so if they are not tender at all, then you have a wrong diagnosis. Okay. Now, what is this Yuan-Source point combination with?
Yeah, Yan source points with Luo-Connecting, Yan source points with Bakshu points,
Okay.
and Yan source with Hussey or the lower Hussey.
Okay, so those are the possible combinations. So the Yan source is very friendly, you know. So connect it with you combine it with Luo-Connecting, you can combine it with Bakshu, or you can combine it with Husi or lower Husi points. How would you define a Luo-Connecting point?
The points connecting two channels exteriorly and interiorly related.
Okay, no, this is easy. What is the therapeutic effect of using Luo-Connecting? Paulit-ulit na.
Treating disorders of their pertaining channels and Zhang organs,
Okay.
interiorly exteriorly related channels or the Zhangfu, corresponding collaterals or chronic disease,
Mm.
mental and emotional disorders.
Okay. The Luo connecting, okay. If the Yuan source can combine with Luo connecting, with the Bakshu and the Hosi and lower Hosi points, to whom does the Luo connecting point, like what are the possible Luo connecting point combinations?
Low connecting with Yen source.
Okay, only with the Yan source. Okay. Now, please discuss the host and guest points combination.
Uh, the Yen source and low connecting point combination from exterior and interior meridian, combination from the same meridian. The
Okay.
host will always be the organ associated with symptoms first noticed. Guest will be the secondary organ affected.
Okay. For example, if you contract a common cold, the cough would be the first thing that you will have to treat. So that would be the host, no? That would be the host. Then the associated
Host.
symptom would be
Sort of.
the low connecting, the guest. Okay. Now, let's review the lung low connecting vessel pathway.
It separates from the lung primary channel at lung 7, follows the lung channel into the palm and spreads through the thenar eminence, connects with the lung channel's interior exteriorly related LI channel.
Wow.
From
Okay.
from
Okay. Anything else?
no, it's at the
No.
same difference.
For the large intestine, what about the large intestine?
L, no, what's it number? From lung 7, is it
Mm.
the Luo-Connecting channel travels to the palm and the thenar eminence.
No, for LI.
LI, wait. Akala ko 53. It begins at the LI6, joins with
Right.
its interiorly exteriorly associated lung channel, 3 soon above the wrist, ascends the arm through LI15 to the jaw and cheek, where it divides one branch connecting the teeth, the other entering the ear to join the
Okay.
Zhangmai,
So it begins at
where
LI6, the LI Lu vessel connect pathway. What about the stomach Lu vessel pathway?
originates on the latter side of the lower leg at stomach 40, and then travels to the medial aspect of the lower leg to join the spleen, channel and then ascends the leg and trunk to the nape of the neck and head where it converges with the chi of the other yang channels, then travels internally to terminate at the throat.
So the star here is stomach 40. So if you needle stomach 40, you're actually affecting the spleen, right? We all know that dampness or phlegm
That
results from a very weak spleen. So the actually we remember stomach 40 as the best, as the phlegm point rather, the phlegm point. Now let's go to the spleen.
originates at spleen 4, connects with the stomach channel, enters the abdomen, and connects with the intestines and stomach.
Okay. If you were going to review, I'm sure you still remember, I don't know, the extraordinary vessel, di ba? Remember the spleen 4 and PCC? Yung ba yun? Kalimutan. Okay, we'll review that again next time. The heart or vessel pathway.
It separates from the heart channel at heart 5 and
Okay.
connects with the SI channel, follows the heart channel to the heart zang, then continues to the root of the tongue and the eye.
Okay. Small intestine, low vessel.
Separates from the SI channel at SI7 and connects with the heart channel, and then ascends along the arm and connects with the shoulder at LI15.
Okay, so LI 15. Bladder.
Separates from the primary channel at bladder 58 and connects with the kidney channel.
Kidney.
Begins at kidney 4 on the posterior aspect of the medial malleolus. Encircles the heel and enters internally to connect with the bladder channel, then ascends along with the kidney primary channel from kidney 4 to a point below the pericardium where it travels posteriorly to and spreads into the lumbar vertebra.
Okay. Pericardium.
Begins at PC6 on the anterior of the forearm, then ascends along the pericardium channel to the pericardium and then connects with the heart.
Santiao.
Santiao separates from the Santiao primary channel at Santiao 5, proceeds up the posterior aspect of the arm and over the shoulder, converging with the PC channel on the chest.
Okay. Gallbladder.
Separates from the primary channel at GB37, connects with the liver channel, descends and disperses over the dorsum of the foot.
Liver.
Liver separates from the primary channel at liver 5 on the medial aspect of the lower leg, then connects with the GB channel and ascends to the genitals.
Conception vessel. Conception lobe.
From descends from run 15 and disperses over the abdomen.
So round 15. Governing low vessel pathway.
Arises at do1 and ascends bilaterally along the sides of the spine to the nape of the neck and spreads over the occiput. And then at the scapular region, it connects with the bladder channel and threads through the spine.
Great luo of the spleen pathway.
Separates from the primary channel at spleen 21 on the lateral aspect of the chest and then spreads through the chest and lateral coastal region, gathering the blood and the Luo-Connecting channels of the whole body.
Okay. Name the locations.
I have no answer on the next three questions. Wala.
Okay. Who can name all the Yuan-Source points? You will
Wait.
Okay. Name
All
from
the points ba?
Okay, very easy, no? Lung,
Lung, ayan.
lung four.
7, 67. Yeah.
SR4, bladder 64.
iPhone.
Okay.
Spleen 3.
Okay, if you needle spleen 4, what other channel can you treat with this point?
The 3 leg.
Spleen 4?
Is it, diba?
If you needle spleen 4,
Spleen,
spleen 4 is
kidney,
the
and,
Luo-Connecting, diba?
diba? Kidney, liver,
Stomach.
and
Stomach, diba? If you needle spleen 4,
spleen
you
6 na
also
rin
treat,
sinasabi
this
ko.
is Luo-Connecting, diba? If you need the lung 7, it can treat, sige, it's okay. Let's just ask the audience. Ako na lang. If you need the lung 7, it can treat lung channel disease, but also disease in what other channel? Anyone?
Lung 7.
LI.
Ay.
From run 15, the low connecting channel travels and
Spreads over the
yeah,
abdomen.
you can see the spreading here of the over the abdomen from run 15. From GB37, the low connecting channel travels to
The dorsum of the foot.
okay, here, dorsum. From lung 7, the low connecting channel travels to
Palm and tenor eminence.
okay, you can see it from the figure. From bladder 58, the low connecting channel travels to the
Kidney
yeah,
channel.
pa doon na papasok, medial. From spleen 4, the loop connecting channel travels to the
Abdomen, stomach, and intestines.
great. The loop connecting channels are distributed blank over the body.
Superficially.
So they're not deep. Superficial lang talaga. From DO1, the loop connecting channel travels where?
Up the side of the spine to top of the head
Yeah.
and at shoulder joints with the bladder channel.
So this figure tells everything from DO1. So it's very important to needle DO1. Can you imagine the impact to lahat? Okay. From heart 5, the loop connecting channel travels to where? Here.
The heart, base of the tongue, and eyes.
Okay. So this is the route, no? Hmm.
Heart,
From LI6, the loop connecting channel travels to the
jaw, teeth, and ears.
okay, so LI6. So that can treat also those issues, no? From kidney 4, the loop connecting channel travels to the
Mm, lumbar vertebrae.
okay, dito. Lumbar. From PC6, the
Mm,
loop connecting channel travels to the
pericardium and the heart.
yes. From SI7, the loop connecting channel travels to the
Shoulder.
from ST40, the loop connecting channel travels to the
Nape of neck, head, and throat.
from SJ5, the loop connecting channel travels to the
PC channel at the chest.
from liver 5, the loop connecting channel travels to
Genitals.
yes. Oh, okay. You have to provide us the prescription. Okay. Since our topic is host guest, so we expect you to, the answer should be host guest.
Point.
There's oppression in the chest, hot palms, cough, swelling of the throat, dry throat, sweating, shoulder pain, breast pain, phlegm expectoration, breathlessness.
Lung 9 and LI6.
Okay, remember this combination. Lung 9 with LI6. Toothache, swollen gums, yellow eyes, dry mouth, runny nose, epistaxis, swollen throat, shoulder pain.
LI4 and lung 7.
Stiff tongue, acid reflux, vomiting, abdominal distension, very easy. Heaviness, constipation, swelling of lower limbs.
Spleen 3 and stomach 40.
Okay, in that order. Abdominal distension and fullness, chest oppression, epistaxis, phlegm, foot pain,
Um,
ankle pain.
Stomach 42 and spleen 4.
Heart pain, dry throat, thirst, yellow eyes, dry mouth, hot palms, palpitations, vomiting, blood or hematemesis, and fright.
Heart 7 and SI 7.
Stiff neck, swollen, painful throat, shoulder pain, deafness. So what is your prescription?
SI 4, heart 5.
Okay. Gait problems, limping, dark complexion, no thirst, desire to lie down, decreased vision, feeling of heat, backache, weak lower limbs, SOB, timidity, heart and gallbladder shivering and dithering.
Kidney 3 and bladder 58.
Okay. Eye pain, neck pain, or neck ache, pain from neck to back, mania, epilepsy, episotonus, eyebrow pain, epistaxis, yellow eyes, contraction of tendons, anal prolapse.
Bladder 64 and kidney 4.
Contracture of the palms, inability to extend arm, chest fullness, swelling of axilla, palpitations, laughing and crying without reason.
Pericardium 7 and Santiago 5.
Yeah. Tinnitus, deafness, swollen throat, dry throat, swollen eyes, earache, pain between the scapula, elbow pain, constipation, urinary incontinence, urine retention,
Santiago 4 and PC6.
abdominal distension, hypogastric swelling in women, chest fullness, vomiting, hernia, urinary retention or incontinence.
Liver 3 and gallbladder 37.
Dull complexion, headache pain, eye pain, swelling of neck, goiter, hypochondriac pain, swelling and sweating of axilla.
GB40 and liver 5.
Okay, when do you use the host guest technique?
When the problem in both internal and externally paired channel and the problem associated with both interior organ and channel and internal problem in both the Zhang and the associated Fu.
Okay. Okay, how do you needle? Like, how do you go about? What do you needle first?
Needle, first needle the Yuan-Source point of the meridian and the needle the Luo point of the meridian last affected.
Okay. Yuan-Source first, then Lu last. Often used for invasion by external wind pathogens. This is very common, especially in Manila now.
LI 4 and long 7.
Okay, remember this. It would be a shame kung nagkakasakit yung ating therapists. LI4 and lung 7. Expert dyan si Madam Apayao, Madam Mildred. Favorite. When pathogenic wind disrupts the function of the lung, acute edema, especially the upper body, and anhidrosis and dysuria.
Lung
Upper
9
body
and
edema, ha? Upper, swelling.
lung 9 and LI 6.
Di ba yung may namatay na artista, talagang swollen the upper,
Oh.
di ba? Lung 9 and LI6. So if you can relate, so maybe you should try to. So lung 9 with LI6. Excessive phlegm pattern, spleen creates dump.
Spleen 3 and stomach 40.
Okay, there are so many patients who are like this. They actually look like they have a lot of phlegm. Psycho-emotional
Mm.
disorders.
Heart 7 and SI 7.
Okay. Tonify kidney yin while sedating the unrooted young from rushing to the head.
Kidney 3 and bladder 58.
Okay. Kidney yin deficiency. Liver blood nourishes the eyes, and deficient liver blood, yin, causes the heat to rush upwards.
Liver 3 and GB 37.
Okay. So liver 3 and GB37. Wow, we're done na pala. Thank you so much.
Thank you, Doc.
Thank you, madam.